and all of that. So I know my time is fast spent, but I'll briefly go through some of the common ones. We have what we call the baby blues or the postpartum blues, and this affects a majority of women. Basically, you are having a lot of symptoms that looks like you are depressed, but it really goes away in a very short time and usually will not go beyond 2 weeks. And majority of women actually go through this. So some of the symptoms, these women are crying a lot, they feel tired, they are having sleeping issues, they cannot think well, they are nervous around the baby, they get easily irritated and annoyed, and they don't know why. And you have that feeling that nothing can be the same or not feeling like yourself. It comes few days after pregnancy, but often by 2 weeks, you are fine. However, if you have these symptoms persisting beyond 2 weeks, then you probably are having depression, postpartum depression. And so with postpartum depression, you need to have had these symptoms persisting and ongoing for 2 weeks. It's also common to have associated anxiety symptoms and sometimes symptoms that have to do with your body, like having pains here and there, headaches, and all of that. And this could actually be depression. So another thing that differentiates the postpartum depression from the postpartum blues, the postpartum blues are milder, so you are not going to have any thoughts of feelings of hopelessness or worthlessness and think about taking your own life or harming your baby. Once that comes in, it is no longer a mild baby blue. And then we also have anxiety, which is very common. It actually affects about 1 in 10 women. But studies have shown that in our parts of the world, it is much more. And if you go to places like the northern parts of our country, studies that have been done have actually shown as high as almost 50% of women having these mental health issues. So with the symptoms, you are feeling anxious, you cannot control yourself, you are worrying excessively, you are finding it difficult to relax, you are also irritable and agitated, you cannot concentrate, and then you have difficulty sleeping. So these are some of the symptoms. But then you can also have physical symptoms like feeling your heart beating fast and loud, you feeling dizzy, feeling like you want to faint, you cannot breathe well, sweating, or feeling a lot of tension and even numbness in your body. So all these could be signs of anxiety. Now, briefly to talk about perinatal and post-traumatic stress disorder. This is an important and serious condition that usually occurs around childbirth, usually during the labor period. And it happens in the context of a traumatic birth. So if the birthing experience was traumatic to the woman and the woman felt very unsupported or disrespected, depersonalized, maybe pushed, beaten, and their feelings were not acknowledged, they have a risk of having traumatic stress disorder. And it's actually common. So you hear some women who do not even want to go through the birthing process again because they are having the post-traumatic stress disorder. So usually what happens is that that traumatic, bad experience you had during the birthing period. During the day, it's like you are having flashbacks of this experience. At night, all your dreams are centered around that experience. Avoid anything that reminds you of that. And then it can affect you in different ways when you find yourself in situations that remind, basically, you are reacting, how your feelings change, how you relate to people and places change. And some of the risk factors for the post-traumatic stress disorder, like I mentioned, if you had a negative experience. But some people, for women who are having their first pregnancy, it may not be the experience, but it may be the perception. You've heard stories, other people, what they went through and all of that. That can put you at risk of peripartum post-traumatic stress disorder. And then if your delivery mode, there was an emergency cesarean section, it also puts you at risk. If you have a low social support from staff, family, and your partner, it also puts you at risk. I decided to bring this because, interestingly, if you have PTSD, it increases your risk of a preterm birth, having a low birth weight in infants, having gestational diabetes, subsequent pregnancies, preeclampsia, and depression. So there's also a strong link with maternal mental health issues with other obstetric complications. Now, this is the last part. I have talked so much, but of course, what I want to say is that when it comes to supporting women with maternal mental health issues, help is available. And I really want to stress on the help. Help is available. Oftentimes, during this period, there's a lot of support that is given without medication. We only give medication in the specialized setting when it is needed. We tend to do a lot more of other things than even medication. So help is available, but oftentimes mental health issues are stigmatized in our setting that affects the health seeking of people. So people may not even want to seek help, even though they know that they find themselves in such situation. Now, when it comes to supporting women, it's important that we need women, these women need to take care of their own self, but they also need a lot of support from their partner and spouses, from the family, from the healthcare system. And I must say that to be able to support women who find themselves with mental health problems and illness, we need to come together as a whole to be able to support these women. Of course, there are other situations we need to consider that cannot be captured here. I'm sure may come up in the questions. Support for partners. So some studies have shown that about 10% of men also have depression in the postpartum period. So they also suffer. They suffer silently. And oftentimes we don't talk about them. There's also another group we don't talk about, those women who miscarry and lose their babies during pregnancy. And it's a very difficult situation for them. And oftentimes we just assume that, oh, you are a woman, you have your womb, you can give birth again, so it's okay. But studies have shown that this is a serious risk factor for mental health issues like depression. So I will end here and make time for some questions.
Thank you very